very heavy psychological impact on children. Here's Lynn Brown.
All right, Jim, thank you very much. This has really been a terrible time for a lot of people, especially those who were directly involved and to those who were indirectly involved. And we're trying to figure out, just one day away from the anniversary of 9/11, how do we go about dealing with post-traumatic stress, dealing with depression? And we have with us this morning Dr. Jaime Carcamo. He is a doctor of psychology. He is with the New York State Psychiatric Institute, and also one of his patients, Jose Sanango. And we thank you both for being with us this morning. And Doctor, I'm going to start with you. Anxiety, depression, post-traumatic stress, put it all together for us. Is there a differentiation?
Right, yeah. Actually, post-traumatic stress is an anxiety disorder. Usually, post-traumatic stress happens with depression. So they both usually happen together, not always. But anxiety is basically fear. Depression is feeling down on yourself, feeling sad. So there is a difference, but they usually happen together. So when people develop post-traumatic stress disorder, they usually have a major depressive episode as well.
Okay, 9/11 tomorrow. For those people who have been treated throughout the year, one day away, what is this going to bring back for them?
Basically, it's going to be a relieving. They can actually, we've seen a lot of people getting worse symptoms-wise. They are getting back to the way they were feeling actually a year ago. So people who have improved are actually, in fact, getting worse because it's bringing a lot of memories. They're reliving the whole experience again, and it's just tremendously difficult for them. And it's now when we are actually asking family members to be understanding, to be supportive, like they've been throughout the year for some individuals.
Okay, Jose, I want to turn to you because you worked very close to the World Trade Towers and you were there in the area that day. Tomorrow is the one-year anniversary. What does it bring back for you?
I think it's everything. Remember, you know, every moment what I was there, and I remember. When I see the TV, I watching TV to the news and you know everything, making me to remember again.
Is it sadness? Is it anxiety for you?
Yeah, it's like anxiety, and you know I feel so bad for that.
And now, shortly after that, you were separated from your children. How does that come into play?
Oh, it's too terrible, you know, for me because 2 months ago I think I separated from my wife and my kids, and for me it's not easy, the life, you know.
A very, very difficult time
yeah.
for you. Doctor, let me turn to you because you can help and maybe with some translation as well.
Yeah.
You have been treating him for what?
For post-traumatic stress disorder and depression. And basically what the way we're treating Jose is a combined treatment, medication and psychotherapy. It's what we call cognitive behavior therapy, when we ask them to relive the experience in the session and then to ask them to confront situations that they've been avoiding. So he's been in treatment for about a month now. Actually, he's one of the persons that seek treatment later, that he waited until a later time. There were some people that came in early, immediately after 9/11, 2001. And he recently just came to our hospital.
Okay, but we are going to be seeing a lot of this. A lot of people are going to be experiencing a lot of different feelings. And if you need help, seek professional help, someone like Dr. Jaime Carcamo. We thank you very much for being with us today. He once again is with the New York State Psychiatric Institute. And Jose Sanango, we thank you very much, and we do wish you much success with your treatment. All right, Jim, back to you.
All right, Lynn, thank you. Thank you, gentlemen.